Hello and welcome to Making the Rounds, a podcast by the American Medical Association. Today's episode is part of our Health IT series from the AMA MSS Committee on Health Information Technology. My name is Christopher Jackson, and I am a medical student at the University of Toledo College of Medicine. I'll be your host for today. Today we're joined by Professor Sara Gerke, an assistant professor of law at the Penn State University Dickinson School of Law. Hello and welcome, Professor.
Hello, thank you so much for having me.
Thank you for coming on. So for listeners who aren't familiar with you and your work, could you give them a little introduction?
Sure. I'm Sara Gerke. I'm currently an assistant professor of law at Penn State Dickinson Law. And my research is really focused on the ethical and legal challenges of artificial intelligence and big data for healthcare and health law in the United States and Europe. But I also research comparative law and ethics of other issues at the cutting edge of medical developments, such as the clinical translation of stem cell research or biological products, reproductive medicine, but also digital health in general. And before joining Penn State Dickinson Law in July this year, I served as research fellow in medicine, artificial intelligence, and law at the Petrie Flum Center for Health Law Policy, Biotechnology, and Bioethics at Harvard Law School for the project on precision medicine, artificial intelligence, and law, or called PMAIL.
Okay, and when we talk about AI, can you give us a formal definition of exactly what AI is so that we all kind of know what we're talking about?
Sure, yeah. So the term was actually already coined very early on in 1955 and has since been always used in society with different meanings. So I cannot really give you a perfect term what AI means. It's more like we don't have a universal definition of AI to date, but the term is often used as an umbrella term, that encompasses several subsets. So, for example, one very important subset of AI is machine learning, which has been the most popular approach of health AI applications in recent times because it allows computational systems to learn from data and improve their performance without being explicitly programmed.
Okay. And you've discussed that there's a need to integrate AI into medical school curricula and the curriculum for physicians. How do you think this should best be done? How do you think we should learn about this?
Yeah, so AI is really rapidly entering healthcare, and I believe will transform the way physicians practice medicine in the future. And so the motivation of this article was really from realizing that medical students need to learn about AI and the unique ethical challenges that are raised by such tools in order to be equipped when using AI in their future profession. So AI raises unique challenges, ethical challenges. So these tools are really different from traditional drugs or devices, So they can be biased, they may be opaque, so-called black boxes, and they may even be capable of learning from new data continuously. And so physicians really need to know how to use such models, So when they should use it, for which patients, and also they need to be able to spot issues with their application. And so they also really need to be able to communicate their functions and benefits and risks to their patients in plain language. And so I really encourage medical schools to create space for discussing those ethical issues of AI in the curriculum. And I'm happy to see already that some schools have now started to do that, such as Harvard Medical School.
Okay. Can you describe some of the biases that you were talking about previously? I know that there are numerous biases that can come into AI, but what specifically are we most concerned about?
Yeah, sure. So there are, as you mentioned, like a major issue right now, a concern of AI in the healthcare space is bias, and there are several types of biases, and sometimes they also overlap, and so it's a very complex issue. So, for example, there is a slogan, garbage in, garbage out applies to health AI. Yeah, so the better the training data is, the better the AI will perform. And so if health AIs are trained on biased data, existing disparities in health may be augmented rather than reduced. Yeah, but it can also be the case that the used algorithm itself exhibits bias. So, for example, there is a recent study by Obermeyer et al. That has shown a substantial racial bias against Black patients in a prediction algorithm used by many hospitals and other healthcare systems to identify and help patients with complex health needs. And then bias can also occur. There is a so-called contextual bias, yeah, in cases where health AIs are designed in high-income countries like the US for low and middle-income countries, or even in the US when you transfer an AI from one context to the other. And then, of course, bias can also be unconscious, yeah. So, for example, or implicit. So, for example, when data scientists choose which parameters to use to help the program learn, they often unconsciously include their own beliefs and values in the code.
Okay.
So this makes it really complicated because there's so many different layers and types of biases.
And knowing that this is complicated and not an easy question to answer, what can we do as base level researchers and students and physicians to eliminate these biases or at least reduce them so that our AIs work better in the future?
Yeah, so sure, this is a complex question, but I think first of all, being aware of this, yeah, so being aware of the fact that AI is prone to biases. I think that's a first thing to know, but of course, we also need to see that also we humans are biased. So, and we always hold an AI to a higher standard than probably a human physician. Still, I think, of course, our idea is to make sure to mitigate biases as much as possible. And so I'm a fan of the so-called, I call it like ethics by design approach. Yeah, so starting early on to identify already in the development process those kind of biases, rather than after a product has been designed and tested. Yeah, it's really essential that we diversify data to reflect different populations adequately to ensure fairness, because the lack of patient data of different geographies, races, gender, socioeconomic statuses can really create biases and likely prevent the most vulnerable patient groups from benefiting from these new AI-based products. I also believe that we need to find solutions to incentivize AI makers to design also for low and middle income countries' needs. And so such a transfer, for example, from one context to another will likely require retraining the algorithm on local data, but it also is essential to involve local people in the design process of health AIs to ensure that these products are useful for low and middle income regions. And in general, I believe it's very important and crucial to have a diverse team, an interdisciplinary team, but also a very diverse team when developing health AIs to reduce biases, especially implicit ones.
And just to backtrack a little bit, there was something that you mentioned before, and that is that AI is kind of challenging not both our ethical frameworks, but also our regulatory frameworks. Because you mentioned that some of these things can continuously update with new data. And as of right now, our FDA approvals for things require that they kind of stay the same. So what other regulatory changes do you think we're going to see as we move towards a more AI in healthcare world?
Yeah, so so I'm currently spending much of my time thinking about how can we regulate how AI-based products, AI-based medical devices, how should we regulate them? I believe that we need, and this is a complex question, but I believe we really need a new regulatory framework for health AI. And there are like really many pieces in this puzzle that we need to put together here. So first, I believe the FDA should review all risky health AI-based products that may jeopardize patient safety before they hit the market. So, for example, right now, certain clinical decision support software systems are not classified as medical devices and thus are not subject to FDA review and regulation, although they may be risky. Then many, or actually most health apps right now that are released on the market will not be reviewed by any kind of regulator before they are released on the market. And then another issue is clinical trials. Yeah, so clinical trials are actually right now in the AI field almost completely missing. They are like very rare, literally really absent. And then what you just mentioned, the problem of adaptive algorithm, that's another very complex issue. If you have so the idea would be actually to have AI algorithms that have the ability to continuously learn. And so the regulators face that question of how do you ensure that those devices remain safe and effective throughout their life cycle. And so here regulators also need to figure out how to regulate those adaptive algorithms in the future. And then finally, I also believe and encourage regulators like the FDA to really widen their scope to from evaluating products to assessing complete systems, and focus particularly on the environment in which they are implemented.
You took care of the nation. It's time for the nation to take care of you. The AMA stood by America's physicians and patients during the pandemic, and we're not stopping there. We're fixing prior authorization, leading the charge on Medicare payment reform, supporting telehealth, fighting scope creep, and reducing physician burnout. It's time to rebuild, and the AMA is ready. To learn more about the AMA Recovery Plan for America's Physicians, go to ama-assn.org/time to rebuild.
That sounds like a lot of work to get done. And how can we as physicians and medical students help to get that work done and make that transition to a more AI-specific regulatory framework? And how do we best work with lawyers, which is something I know people don't like to do, but it's something that's going to have to get done to make sure that this occurs?
Yeah, so I think students and medical students can already already have now an important role and can have a voice in the debate. So I believe in general, AI, there are complex issues of AI in healthcare, and I do not believe we can solve this alone. We need a diverse interdisciplinary team. We need all stakeholders at the table. And that's not only the AI manufacturers, these are the physicians, medical students, regulators, all kind of experts. And I believe medical students already now can say they want to learn more about AI, learn about the ethical issues, etc., so that it may be that they are interested in those issues, so that it may be implemented in the medical school curriculum, so that it will be a standard course which will be offered. Because I believe that new technology, digital health, the digitalization of the healthcare system, these will shape and change and transform how you as medicals as physicians later on in your profession will actually practice medicine.
Okay. And now to make a little bit of a turn. So how do you feel that COVID has impacted your work? What changes have you seen with that?
Yeah, so I mean, COVID has definitely impacted my work a lot. So I believe we have seen throughout the pandemic the importance of digital health and also the value of data, and data sets. And so collecting data and analyzing data. And the global health AI market size is in general expected to increase rapidly over the next years, and especially the COVID-19 pandemic has hastened this adoption of digital health tools. So, for example, especially early on in the pandemic, we saw a tremendous shift of monitoring tools from the clinic to the patient's home. And so, for example, I wrote an article with colleagues from Harvard Law School and the Brigham and Women's Hospital in Boston, published in Nature Medicine in 2020, in which we, for example, analyzed the regulatory, safety, and privacy concerns of home monitoring technologies during COVID-19. And so here we looked not only at emergency use authorizations for home monitoring devices, but also at privacy issues, a comparison between the US and Europe. And in general, throughout the pandemic, I wrote several pieces on different ethical and legal questions of digital medicine, through such as contact tracing or exposure notification apps, but also digital health apps in general during the pandemic, surveillance question, telehealth. Yeah, we had a huge boom in the telehealth sector through the pandemic, and then also about COVID-19 antibody testing.
What do you feel is the impact of your work, and have you experienced any challenges?
Yeah, so I would say I'm spending like most of my time thinking about the ethical and legal challenges raised by artificial intelligence in healthcare, such as informed consent, bias, inclusion and equity, privacy and security, FDA regulation, also liability. And I really do hope that my work impacts how health AI tools are implemented in clinics and in our daily life. So, for example, as mentioned before, I'm a supporter of the ethics by design approach. Yeah, so AI companies should identify and address early on in interdisciplinary and diverse teams ethical issues raised by their AI-based products, such as bias. And it should be really a moral imperative to develop AI tools that are meaningful for the healthcare system and also can be integrated seamlessly into the workflow of a hospital, for example. And most important, AI tools that improve patient outcomes. And I also hope that my work shape policy decisions and regulations of health AI-based products. So one of my goals is to promote innovation for a better healthcare system, while at the same time ensuring that marketed systems are not only safe and effective, but also remain safe and effective throughout their life cycle, and especially benefiting all of us, yeah, including the most vulnerable population groups in our society. So that's why my work currently looks and focuses a lot, and I'm thinking about this a lot, how a regulatory framework for health AI could and should like to achieve such goals, yeah. I think we still need to figure out many challenges. Health AI just raises very complex questions, starting, from developing the necessary infrastructure and equitable access to the safe use of such systems. But I'm still an optimist, and so we hopefully will together in collaborative teams overcome them in the future.
And just to interrogate the Just to interrogate the ethics by design question, there have been plenty of inventions that have started off with good intentions and then have somehow wandered into being something that is less so, I guess, has less utility for all of society. How would you make sure that your AI platform doesn't delve into something like that or stays ethical?
Yeah, so I believe a regulatory review is imperative, especially if you have AI products that are risky and may jeopardize patient safety. So I think not only thinking ethically through the development of the process, but you also should have always like a second eye looking over that and reviewing it. But then again, even then, once an AI is implemented in the clinic, here the role of the physician will be very important. Yeah, we need to educate physicians, and that's why also I'm for educating medical students already now about those systems. Yeah, so that they know that they may be prone to biases, even if they were checked in advance. Yeah, especially if you have an adaptive algorithm someday, you may want to continuously actually check and monitor the system while being used in practice. And so I think because healthcare is different than other sectors, because you have many different stakeholders involved, from the development to the physician who is using it, or the patient, even if you have a direct-to-consumer product, where you need to make sure that everyone understands how to use them safely and effectively. And so I do hope that AI manufacturers look more into the question, what is actually beneficial for the healthcare system, and create or develop AIs that are meaningful and improve patient outcomes, for example, because right now we see that many AI systems that are being developed and not actually and are on the market have not actually shown that they do improve patient outcomes.
Okay. And when I'm a practicing physician here in 10 to 15 years, how do you think healthcare will have changed?
That's a good question. I don't know. I unfortunately I don't have like a crystal ball to see the future, but I would say I do hope that we are in 10 to 15 years that we are at a point where AI is in a positive way integrated and deployed in the healthcare systems, that we have like a learning healthcare system where actually the distinction between clinics and the home is more and more gone. Yeah, so that we have like a complete learning data healthcare system, that the digitalization in the healthcare systems happened, and that actually new innovative tools made the healthcare system stronger and really improve the healthcare system. But most importantly, that we have tools in place that are beneficial for everyone and all of us, and not just for specific patient populations.
Okay. Thank you for speaking with us today. And as a last question, where can people out there connect with you and follow your work? Is it Twitter, a website? Where can they see what you're doing?
Sure, yeah. So the best is Twitter. You can follow me on Twitter at Gerke _Sara, SARA, and Gerke GERKE _Sara. You can find me there. You can also connect with me on LinkedIn. You can find a list of all my publications on Google Scholar. Also, you can check out the website of Penn State Dickinson Law, where you can find more information about me and my background, and also my research.
Okay. Well, everyone, that's all for today. Thank you for listening, and thank you for your time today, Professor Gerke.
Thank you so much for having me. Take care.
This has been Making the Round, a podcast by the American Medical Association. You can subscribe to Making the Round and other great AMA podcasts wherever you listen to yours, or visit ama-assn.org.